Good morning. This is the respiration lecture, part one. There are two parts, so make sure you don't forget to look at the other half. So this first part is mostly the anatomy part, and part two is mostly the physiology part. Of course, those aren't completely divorced from each other, but that's the general trend on these two lectures. All right, so first of all, as we learned way back in chapter 1, no system works in the body by itself. And the respiratory system works very, very closely with the circulatory system. And here is the overlap. It's very common to see in standardized tests a question that's something like, which of the following functions works with both the respiratory and the circulatory system, or something like that. Okay? Well, the answer would be oxygen and CO2 exchange between the lungs and blood. That's how the two work together. All right, so the four different purposes that we have here, two are respiratory, two are circulatory, and then we've got this one that overlaps. All right, so purposes or functions of the respiratory system are breathing, obviously, and O2, CO2 exchange between the lungs and blood. Now, the circulatory system picks up with that, takes the oxygen in, puts the CO2 out of the blood, and it's in charge of carrying those two in the blood, and it's also in charge of exchanging those gases at the tissue level. Okay, this image, I'm not exactly sure what image I will use. I'm going to try to use the coloring book image. If that won't work, then I'll have to use this image or something similar to it for labeling on the exam. All right, so let's take a look at the parts here. We've got a nasal cavity. Okay, that's this whole open space here. You've got the nostrils. The nostrils are just the openings, not inside the opening. Okay. Then you've got the pharynx, which starts up here behind the nose and goes down to where the larynx starts. Okay, so pharynx, and we'll talk about pharynx a little bit more, actually is divided into three parts. Okay, now we've got the oral cavity. All right, so that's inside the mouth. You've got the larynx. That includes the epiglottis, which is the flap that covers the trachea so that you can't get food or drink particles, things like that down in there. Of course, if you're talking and eating at the same time, you're swallowing and breathing at the same time, and usually you don't do that. So that's when you get choked on the little crumb, or something we say it goes down the wrong pipe or down the wrong tube. Well, that's because you're not supposed to be jaw-jacking while you're eating. Your body doesn't know which one to go with. It can't have the epiglottis open so that you can talk and be closed so that you can eat all at the same time. So if you do that, you did it to yourself. All right, then you go down into the trachea. That's what we call the windpipe when we're little kids. Okay, splits inside the chest to go into the lungs. And that split creates the left primary bronchus and the right primary bronchus. And that the place where it splits here, this Y, is called the carina of the trachea. Okay, now you've got a left lung, and you'll see that it has two lobes. And you have a right lung, and you see that it has three lobes. All right, give you just a second here to think about why are there only two on the left and three on the right? You're having trouble with that. You also notice that there's a little cutout, little carve out here. What might go there? If you said the heart, you're right. Okay, so yeah, the heart takes up part of the space. There's not room for three lobes on this side. Plain and simple. All right, and then very, very important is actually a muscle that goes across from side to side, front to back. It's called the diaphragm. Without the diaphragm, you don't breathe, not on your own. All right, in the respiratory system, you have two major zones. You've got the respiratory zone, you've got the conducting zone. Respiratory zone is just the air passageway. There's no gas exchange, O2, CO2, switching places, none of that. It's just the pathway to get from your mouth or your nose down to your lungs. That's it. It does nothing else. Conducting zone is where the gas exchange actually happens. So it's down in those bronchioles, which are teeny tiny little passages, and the alveoli, which are the little air pockets down at the bottom. And we'll talk about those here in just a minute. That's the conducting zone. Now, respiratory muscles. The diaphragm, as I said, is the major one. But there are other muscles that we call accessory muscles that help you to breathe. Now, you'll notice some people, when they breathe, their shoulders go up. Okay, that's not right. You're not really supposed to breathe that way. And any musician knows you don't breathe like that. Or you're not going to be able to hold notes a long time. Or you're not going to be able to sing and without taking gaspy breaths all the time. So musicians are taught that they're supposed to breathe with their belly. It's called abdominal breathing, okay? It doesn't mean your stomach sucks in air. It means you push all the air all the way down to the bottom of your lungs, which is going to push your diaphragm down, which is going to make your stomach pooch out, okay? If your stomach does not come out when you breathe in, you're not breathing right, and you're not getting your maximum volume of air, okay? So now when you breathe with your shoulders or you breathe high in your chest, the problem that you see there, and if you watch yourself in the mirror, you will see the muscles in your neck will tense up. Okay, that's going to end up creating neck, shoulder, and arm problems. And you're probably thinking, this woman's nuts. How is breathing going to cause neck, shoulder, and arm problems? Well, trust me, it does. When you gasp and your shoulders come up when you're breathing, that's the neck muscles pulling your rib cage up to help get you some more airspace. Well, when those neck muscles get used all the time, they're going to tighten up. Okay, well, here's the problem. You've got nerves that go down into your shoulder and down into your arm that come through those neck muscles. So, if those muscles are tight from helping you breathe, then they're going to pinch on the nerves that go down through the shoulder, down your arm. If you had me in class, you know that's the brachial plexus. Okay, so yeah, so absolutely, breathing wrong can give you numb hands and fingers. It can give you shooting arm pain, all kinds of things. Okay, so must learn to breathe right if you don't already. Now, I will say this, at night, your body reverts to breathing correctly. And if you've ever watched a baby breathe, especially when they're sleeping, their little tummy all pooches out and everything, and it's so cute. Okay, that's the way you're supposed to breathe all the time. So then the question comes, why don't we breathe like that? It's because we are trained to suck in our gut. Don't let your stomach pooch out. Well, guess what, folks? It's soft on the front so that it can come out. Did you ever think of that? If that was supposed to remain completely flat 100% of the time and never stick out any, then we would have had a wall of bone around it. But it's not. It's soft in the front so that we can breathe and so that our guts can expand when we eat. So stop sucking in your gut, right? Use your abdominal muscles, that's fine. But you can still breathe correctly and hold in your gut muscles. Okay? You can do that. You just want to make sure your shoulders do not come up when you breathe. That is a tough habit to break. Okay, moving on. The nose. Okay, what's it for? It provides an airway. It moistens and warms the entering air. You know, we don't have much of a winter around here anymore. We used to, but it doesn't seem like we do much anymore. But when you were a kid, you might remember when it was cold outside that if you breathed in really fast, it would give you almost like an ice cream headache kind of a thing. That's because you were breathing faster than your nose could warm up the air. And sometimes your chest would hurt, especially if you're a mouth breather, because the air isn't passing through a bunch of little chambers when you just open your mouth and breathe. So if you're going to be outside in the cold, you want to be sure to breathe through your nose, not through your mouth. The next thing it does is the nose filters and cleans the inspired air. All right, well, you've got all those little hairs in there. Now, it's unattractive to have the hairs sticking out the front of your nose. It's okay to clip those, but don't dig way up in there and cut those hairs out. They belong there. They're there for a purpose. They're filtering out bugs and dirt and all kinds of stuff. And for heaven's sake, don't eat your bugs. Oh my goodness. There's all kinds of bacteria and pollen and all kinds of things that your nose is catching. So yeah, don't eat that. That's gross. Okay, and so if you're mouth breathing, then you don't have that filter. That junk is going right to your lungs. Ew. All right, the nose also serves as a resonating chamber for speech. You ever notice that when somebody's got a cold and their nose is stuffed up, that they sound funny? They sound sort of like this, and their sound is very dead. It doesn't ring. You can't say NG sounds when your nose is stuffed up. Did you ever notice that? So, yeah, that's because the air, as it passes through the vocal cords, up into your mouth and everything, it acts sort of like a great big vaulted ceiling. If you've ever been in a big warehouse or a big church that has the really tall ceilings, how sound just rings through it, right? Well, your nose gives you that resonating chamber. That's what that's called. And the last thing that the nose does is it houses your olfactory receptors. That's your sense of smell. Remember, those come through the roof of your nose, through the cribriform plate of the skull. So if you didn't have air passing through your nose, then you wouldn't pick up sense of smell. All right, things you need to know are in red. All right, so you've got the cribriform plate. We just said that. And that's the holes in the floor of the skull here. The nerves come down through the little holes into the epithelial layer in the roof of the nose, the nasal cavity. Then you've got the sphenoid sinus. You've got the nasopharynx, which has a couple of different parts here. The nasopharynx has the pharyngeal tonsils. That's tucked up in there in the corner. We talked about tonsils in the last chapter. You've got the opening of the eustachian tube. So this little hood here has a tube that goes up inside to your ear, and that's where the fluid from your ear drains. All right, so does it make sense, as we're looking at this picture, if your tonsils are swelled up, that it could push this tube closed? No opening there? And that's how fluid gets trapped in your ears? And when fluid is trapped in a warm, wet, dark place, it grows bacteria. And that's how you get an inner ear infection. Okay? All right, very seldom is your eardrum punctured. It's because this is closed off. Whether it's because the tonsils are swelled up and pushed it closed, the pharynx itself is swollen and pushed it closed. And look, you've got all this snot and everything that's going right past it. If you've got a sinus infection, that the bacteria will travel up the eustachian tube, and ta-da, you're in the inner ear then, okay? Or middle ear, excuse me. I said inner, it's middle ear. Okay, so that it has to drain somewhere. So there are pros and cons to its location. Then you've got the uvula. That's the dangly thing in the back of your throat. Now, the next section down is the oropharynx. Oropharynx. So you've got nasopharynx is down to the uvula. Oropharynx is behind the mouth, essentially. Oral, nasal. See how that goes? Okay, so we've got the palatine tonsils. That's the tonsils you can see in the back of your throat, okay? Let's see, and then that's what you need to know as far as part of the oropharynx. Now, when you look back here, looking through your mouth, looking at the back of your throat, that's right here, that's where you would see like the blisters and stuff if you have like strep throat or something like that. And then, of course, you can see the tonsils, as I said. Okay, then you've got lingual tonsils. Here's your tongue, okay? At the base of the tongue, right above the epiglottis, is the lingual tonsils, okay? So if you've ever noticed that sometimes you have a lump in your throat feeling, sometimes it's your lingual tonsils are swollen up. Now, you have the laryngopharynx. Well, the larynx is in there, and parts of the larynx that you need to know are the epiglottis, and that's this flap that goes over this hole. See this tube right here? You got trachea, creates a hole right here. Well, this flap, this epiglottis, covers that hole, covers this opening, so that when you swallow, as I was saying earlier, the food in your beverages don't go down into the trachea instead of down the esophagus. So esophagus is the tube to the stomach, trachea is the tube to the lungs. All right, couple other things to look at. We said epiglottis already. Thyroid cartilage right there. Some people have a bigger thyroid cartilage than others. A big thyroid cartilage is what we call Adam's apple. Okay, so inside here, and we're going to get to the details of the larynx later, but there are vocal folds and vocal cords. And so when we talk about that, we'll talk about how guys are bigger, and that's going to create a larger thyroid cartilage. So we'll discuss that a little bit more. Okay, other little things on this side. Let's see. You've got a frontal sinus, that's in your forehead. So, you know, a lot of people will say it feels like somebody hit them right between the eyes when they've got a sinus cold, sinus infection, something like that, or a migraine. Sometimes that is due to sinus pressure, and that is right between your eyes, that flat spot between your eyebrows. Okay, need to know nostrils, need to know hard palate. That's the ridged part. If you stick your tongue up behind your teeth, and then you follow it back, you can get to about here. Most people can't go much further back with the tip of their tongue. It's hard to there. It gives you some place to push your food against, to smash it down while you're chewing, okay? And it gives you a place to push your tongue up against to create different shapes in your mouth, to create different sounds. And then you've got the soft palate, and that allows a bigger opening if you need it when you're swallowing. Then we talked about tongue already. We talked about lingual tonsils. Hyoid bone, this is a cross section, of course. It's really kind of a U shape. So we're just looking at a cross section of the bone. And this is the only bone that isn't attached to another bone. It's only attached to muscle. The sinuses. We talked about this a little bit. Some of the sinuses you couldn't see in that last picture because of where they're located, but we saw the frontal and the sphenoid. Then there's ethmoid, That's kind of under the eyes. And then there's maxillary, that's in the cheekbones. And sometimes a medical doctor will push under your cheekbones, kind of on either side of your nose, and ask you if that's tender. Well, if your sinuses are inflamed, then that's going to be tender, and he's going to probably think sinusitis. And then depending on the color of your snot, whether it's clear or whether it's greenish or yellowish, will determine whether he thinks that's bacterial or viral. And from there, he'll tell you what you need to do. Okay, but that's what he's doing, is when he's pushing on your cheeks like that, he's checking to see if that's tender and swollen. Now, the sinuses actually perform a couple of functions. Well, it warms the air as it goes through, but it also helps to lighten up the skull. If all of the bones in your skull were completely solid, then your head would weigh a ton, and that would be really hard on the vertebrae of the neck and the nerves and the neck muscles. So sorry about my phone is going off over here. So that would be really hard on the neck. So you've got these sinuses that lighten your skull by about a third, which is pretty awesome. And like I said, the air, if you breathe through your nose, will spin through the sinuses, and as the air is touching the sides of the nasal passages, it's going to pick up moisture. That's part of the reason too why when it's really dry outside and you aren't getting much moisture, like the fall is dry. Sometimes winter is really dry, especially if you have heat on in your house. You don't have much moisture there, okay? And so that causes headaches in some people, and sometimes we get sick easier in the winter. We don't have that nice moist area to help catch the bacteria. It just goes right to your lungs. So there's lots of problems with humidity. So if it's really dry in your house, then you need to have a vaporizer or a humidifier, not a dehumidifier, a humidifier. So that'll help keep the moisture level up. The other thing that's kind of weird about the body is if the moisture level is too low in your home, your body will start making extra mucus where it can to kind of make up for the loss. So sometimes all the snottiness that happens in the wintertime is just because your house is too dry. So, put a pot of boiling water on the stove, put water near the vents of your AC, like if you have floor vents. Like I said, get a vaporizer or a humidifier. Steam is better than cold. Just be careful if you have kids or pets that it's not in their reach. But that will add lots of moisture to your home, and in turn your sinuses won't have to produce so much mucus, and maybe the whole issue will just go away. Okay, so this is just a picture of the three areas of the pharynx that we talked about. You've got nasopharynx, that's in the pink. You've got oropharynx, that's in the blue, the medium, light blue. And then the medium blue is the laryngopharynx. Okay? Alrighty. Let's see, the larynx. We've talked about this already, but the epiglottis is an elastic cartilage flap that covers the opening to the laryngeal inlet. That's just above the trachea for when you're swallowing. This one you are not going to have to label, but it's kind of a close-up of what we looked at before. I kind of cut out the other pieces. We're going to get into vocal folds and such here in just a minute. All right, voice production. First of all, guys have a lower voice than girls as they age. Now, little boys have a higher voice, and in their early teens, they start going through this voice change thing. And so sometimes their voice is high, sometimes it's low, and sometimes it kind of jumps around. And it sounds funny and we laugh at it. We probably shouldn't because it's not their fault, but it is kind of funny, no kidding. And so that whole change in your voice happens when what else is happening in their body? Well, that's when the hormones are starting to kick in, right? So as the hormones kick in, they start developing the male characteristics. And one of those is that things start to enlarge, like the larynx starts to enlarge. And when it does, the vocal cords that are stretched between across the opening of the larynx are going to get longer. Now, those of you who have been musicians in the past or present, either one, whatever, what makes a sound lower? Does anybody know? Okay, think about the lowest sounding instruments that you could think about. Wind instruments, that is. Okay, things like a tuba is a very low sound, right? If you took all that tubing from the tuba and you stretched it out, that would be a very long instrument compared to if you took a trumpet and you stretched all the tubing out. And then if you think about a trombone, that would be somewhere in the middle. Trumpet makes a higher sound, a trombone makes a lower sound, and the tuba makes the lowest sound. And a trombone, if you slide the slide out further, it's making the tubing longer and the sound gets lower, right? When you bring the slide of the trombone back in, it makes the sound higher. It's shorter. So the longer, the lower. Longer, lower. Longer, lower, longer, lower, longer, lower. If you look at a flute and a piccolo is only about 1 foot long. A flute is 2 feet long. A piccolo is a higher sound. A longer flute is a lower sound. Okay, so if we take that concept and put it in your body, the longer the vocal cords, the lower the sound. Well, in order to have longer vocal cords, that means the larynx needs to be bigger, and so it's going to stick out, and that's what we call an Adam's apple. Okay? All right, so a couple of voice production notes here. You've got speech, intermittent release of expired air while opening and closing the glottis. Okay, so as you're blowing air out, it passes over the vocal cords, and the glottis opens and closes. Glottis is the gap between the vocal cords. Glottis is the gap between the vocal cords. So as the air comes out through the gap between the vocal cords, you're going to make sounds. Okay. And depending on the pattern that sound is making, we call speech. If you don't change the opening and closing of the glottis, the space between the vocal cords, then you don't make speech, you don't make words, you make sound. Okay? Sound is shaped into language by muscles of the pharynx, the tongue, the soft palate, and the lips. So if the glottis doesn't change, if it doesn't open and close, then you just make sound. If you open and close the glottis, it makes speech. And when you change the shape of the pharynx, the tongue, the soft palate, and the lips, that makes individual language, words, phrases, stuff like that. Okay? Now, pitch. Pitch is the highness and the lowness, and we just talked about this quite a lot already. Pitch is determined by the length and the tension of the vocal cords. The longer, the lower the pitch. The shorter, the higher the pitch. Loudness depends on the force of the air. So if somebody talks really quietly, and I hope you can hear this, if somebody talks really quietly, they don't have much force behind their air. But if you're like me and you you talk really loud, it's because there's a higher force of the air over the vocal cords, and so then you're a loudmouth like me. Now, the chambers of the pharynx, the oral and the nasal and sinus cavities amplify and enhance the sound quality. So, you know, when people try to sing, some just aren't, they don't have a pretty sound to their voice. And it may not be their fault. It may be just the shape of their mouth or the shape of their sinuses or the length of their cords combined with these different shapes. The size of lips, all of those things can make a difference in how a sound comes across to others. And so you can't change that. There's a few things that you can do to tweak the shape of your mouth, like the difference between an ah sound and an a sound by pulling your cheeks back. You can do stuff like that, but the actual tone of your voice, can't do a thing. Absolutely can't do a thing about it. So not your fault if you just don't have a great sounding voice. Okay, now continuing the conducting zone structures, we've got trachea. And remember I said that splits into the right and left primary or main bronchi. Now, the right main bronchus is wider, so wider diameter, shorter, and more vertical, so it goes more up and down, than the left. The left then is narrower, longer, and more horizontal, right? Does that make sense? So the right one is wider, shorter, more vertical. The left one is narrower, longer, and more horizontal. Think for a second about why the bronchus on the left side would have to be more horizontal. What would be in the way that would keep it from going vertical? Oh yeah, there's a heart in there. That's right. So, so if you think about that structure with the left one being more horizontal and the right bronchus being more vertical, if some little kid inhales a Polly Pocket shoe or whatever else kids will inhale, where do you think that Polly Pocket shoe is liable to land? Left side or right side? Almost always the right side, because as they inhale it, it goes straight down. And then the left or the right bronchus continues going down, right? Where the left bronchus would have to make a side turn. Well, that's probably not going to happen. So, so if a kid inhales something, then it's probably going to go down and then into the right bronchus rather than down and take a 90-degree turn into the left bronchus. All right, and then from there, the main or primary bronchi branch off into smaller ones. And in this case, there are 2 on the left and 3 on the right. What does that go along with? 2 lobes on the left, so there's 1 secondary branch that goes to each lobe on the left. And there are 3 on the right. There's 1 secondary branch, secondary bronchus, that goes to each lobe on the right. And then from there, you're going to get even smaller. So you've got trachea, left primary bronchus, right primary bronchus. Then you have secondary bronchus, secondary bronchus. This one's heading south to the bottom, the inferior lobe of the lung. This one takes care of the superior lobe of the lung. On the right, you've got a superior, a middle, and an inferior, secondary bronchus. And that goes with the superior lobe of the lung, the middle lobe of the lung, the inferior lobe of the lung. Okay, no brain surgery for that one. That one's pretty simple. Respiratory zone. Okay, so this is where the actual gas exchange is going to happen. And that starts with what are called respiratory bronchioles, alveolar ducts, and alveolar sacs. The respiratory bronchioles are the tiny, tiny, tiniest branches off of the secondary bronchi. So you've got primary are big and thick, and they're about the size of your thumb. Okay. Then you've got secondaries that are smaller. Then you've got tertiaries, which is the next branch down. And then you've got respiratory bronchioles, okay? Alveolar ducts, and then alveolar sacs. Those are kind of like little grape clusters at the end of the respiratory bronchioles. So here's what that looks like. All right, so you've got tertiary or terminal bronchioles. You've got respiratory bronchioles that actually have the alveoli hanging off of them. And see what I mean by it looks like grape clusters? It really kind of does. And if you cut through a lung, then you're going to see all these little air pockets. That's what all these are. These are bronchioles, tubes, and these are little teeny tiny air pockets. Some of them you can see better than others, that they're circular. You know, these, not so much. You've got some alveolar duct there with some alveoli hanging off the ends. But some of them are real easy to see that they're circles, like that one, and that one, and that one, and that one. Okay, so when you look here, it makes more sense. Okay, so now we're adding in some circulatory system stuff. We've got the capillaries that make a little network on the outside of each of those tiny little alveoli. Okay. You've got elastic fibers, that's these little yellow stripes, that keep the alveoli from over-expanding and helps to squish the air out of them. So that's cool. Then you've also got smooth muscle that contracts in the bronchioles themselves. Now, one of the problems with the smooth muscle is when it contracts, but you're trying to breathe. Can you think of the condition that might be called? When your bronchiole are constricted and you're trying to breathe through that. That would be asthma, maybe. All right, this is a real live close-up, scanning electron micrograph of alveoli, and you can see all the little networks of capillaries that lie over each one. Sorry about the noise. My neighbor just decided he's going to start mowing his grass. Now, had to do it now, right? All right, the lungs, the bronchi, and the subdivisions. So the air passages undergo 23 orders of branching. That means, the orders of branching, that means you start out with the primary, well, you start out with the trachea, and then you branch into 2 primary branches, and then 5 secondary branches, and then you branch again, and you branch again, and you branch again, and you branch 23 times total till you get down to the alveoli. So this whole branching thing, smaller and smaller and smaller and smaller and smaller each time, that creates what they call the bronchial or the respiratory tree. We're going to actually see a picture of the respiratory tree in a minute. Okay, so in this picture, you need to know everything on here. All right, let's take a look. We've got trachea sticking out, and you can tell because it's got the ribs that go across. You've got the thymus that lies over top of the trachea. You've got the apex of the lungs, that's the tips up here. You've got the right superior lobe of the lung. Horizontal fissure goes between the superior and the middle lobes. This is the middle lobe. Then you've got the oblique, right oblique fissure, goes between the middle lobe and the inferior lobe of the lung. You've got diaphragm. You've got base of the lungs. The way I always remember that is, well, base is on the bottom. You don't really want to do that though, because with the heart, the base is on the top, isn't it? Base is broad. Even on the heart, which the base is on the top, the base is broad. The apex is pointy. Apex is pointy, base is broad. Apex is pointy, base is broad. That works for lungs and heart. To try to remember that. Then on the left side, you've got the left superior lobe, the left oblique fissure, and the left inferior lobe. All right, so when we go to labeling things for our practical exam, which I'll explain how we're going to have to do that if we're doing that online, things that you need to say left and right. You need to say left and right on superior lobe, because there's one on each side. You need to say left and right on inferior lobe, because there's one on each side. You need to say left and right on the oblique fissures, because there's one on each side. You don't need to say left or right with middle, because there is only one. And you don't need to say left or right with horizontal fissure, because there is only one. Okay? If you say right, it's not going to be wrong. Just make sure you don't mess up and say left, because I'm going to have to count that wrong. Okay? All right, then you've got the heart lies in the mediastinum. That's the center cavity. You've got the cardiac notch, which is this dent. We talked about it earlier. Let's see, did that get everything? I think that's everything there. On the little cutout here, you've got intercostal muscles between the ribs. So you've got rib, muscle, rib, muscle, rib, muscle. And if you like barbecue spare ribs, you know about that. It's rib, muscle, rib, muscle, rib, muscle, right? Well, you have that too. Then just on the inside of the muscles and the bones is a lining, okay? That is the parietal pleura. That's this first light layer here, okay? Then you've got a cavity. It's a space, a literal space. Then you've got the visceral pleura. That's this inside light color. Remember that visceral linings cover the organs. Visceral organs. Visceral lining, visceral organs. Okay? And then you've got the space in between. We're going to talk about what goes in there a little bit later. All right. Remember I said respiratory tree? We're going to look at a picture of this. Well, this is a lung that has been plasticized. The passageways have been plasticized. So cool. They take different colors of latex and they inject down in the different parts of the lung and they let it solidify. It's like plastic. And then they dunk the whole deal down, the whole lung with all the latex plastic stuff down in acid, and the acid eats away at the lung tissue and just leaves this latex plastic stuff. It is really, really neat. There used to be a human plasticized display that was traveling to different big museums. I think it was called Visible Human, but I wouldn't swear to it. But anyway, they did this with human bodies and a horse, and I can't remember what else was there now. But they did this with, they did it with blood vessels, they did it with lymphatics, they did it with the lung passages, all kinds of stuff. And then you take away all of the meat and the ligaments and tendons and all of that stuff. You take all that away and it leaves just this. Neatest thing I've ever seen. Very, very cool. I don't know if it's ever been in Kentucky or not, but if you ever see or hear about that, you need to go see it because it's worth going. All right, this is the last slide for this half of the lecture. And so we're looking at a cross section through part of a lung. Now, on most MRIs or CTs, they give you something that tells you what level you're at. So are you up here near the top? Are you in the middle? Are you down to close to the bottom? But a lot of times you can tell by what's in the actual image as to where you are. So let's take a look. You've got vertebrae, you've got heart, and you're seeing a valve there. Okay, so you've got the valve that's in the most front is pulmonary trunk, and then the one behind it is the aorta. Okay, so we can see the valve in this picture. So that tells you you're at the valve level of the aorta. You're coming right out of the heart. Okay, now what's a little unusual about these pictures is they don't have this set up like an MRI or a CT scan would be, because with an MRI or a CT, you're laying on your back, and so the vertebrae would be at the bottom and the heart would be at the top. So just always, always, always orient yourself before you get started, okay? So in this case, you've got vertebrae up here, that's the back, and you've got heart is down here, sternum is there, that's the front. That means they're laying on their belly. Now, I'm going to assume that they're just taking this picture and they're flipping it forward and looking down. Okay. In an MRI or a CT, you'll always be on your back and looking up from the feet. So orient yourself first about where you actually are and what position is this patient in. Okay. All right, so since we've got sternum down here, vertebrae up here, the patient's on their belly. Now, the heart is more on the left side than the right. So if you drop a vertical down through the vertebrae to the sternum, you can see there's more heart over here than there is over here. All right, well that helps because that means this is the left side, this is the right side. Now you know back, front, left, and right, and you're oriented. Okay, so coming from the front, we've got sternum, we've got heart. The first vessel we encounter is going to be pulmonary trunk, and we can see how that splits. Pulmonary trunk splits into left and right pulmonary arteries, right? Okay. Then you've got the two tubes behind that. Those are going to be the bronchi. So that's going to be the left primary bronchus. That's going to be the right primary bronchus. Okay. Then behind that is esophagus and descending aorta. Then you've got vertebrae. So front to back, let's run that again. You've got sternum, heart, pulmonary trunk, pulmonary arteries, left and right, pulmonary bronchi, left and right, esophagus, and descending aorta, vertebrae. Okay? All right, let's see if there's anything else. Now, we can't really see too much about the pulmonary veins. They're hidden under here. So we're not going to worry too much about that. You can see the layers of the pleura. Lining the cavity is parietal. Lining the organ is visceral. All right, and that's all I see on here that we need to take care of today.